When I see patients in consultation to help them find ways to achieve pregnancy, a frequent question is one of, who are candidates for genetic testing? And there's really a couple of categories of things that are most appropriate for genetic testing. Some patients have things that we call single gene disorders. They have all the right numbers of chromosomes, but their chromosomes have certain mutations within them that can result in genetic abnormalities with their baby. And single gene disorders are things like Tay-Sachs, cystic fibrosis, hemophilias, sickle cell disease. And so if a patient has a family history of these particular single gene disorders, we can map their chromosomes and we then put them through our higher technology treatments like in vitro fertilization. We stimulate ovaries, we collect their eggs. Eggs and sperm go together in the lab, we create embryos, but then when the embryos have developed to sometimes 3, sometimes 5 days of development, we can actually in the laboratory take a cell or multiple cells out of the embryo and look at them genetically, targeting these specific single gene defects that family has demonstrated. So one indication for genetic testing are single gene disorders. One of the more common reasons for genetic testing is a condition we call aneuploidy. And aneuploidy just means embryos that have an abnormal number of chromosomes, too many or too few chromosomes. And the typical candidates for having an increased risk of aneuploidy are women who are getting older. And what happens is every egg that a woman has starts out with 46 chromosomes inside. When they ovulate, though, there's actually 23 identical pairs, so 46 total. But when they ovulate, the egg has to get rid of half of those chromosomes right before ovulation because you want an egg with 23 chromosomes to meet up with the sperm with 23 chromosomes and make a baby that has 46, half from mom and half from dad. But as a woman ages, the machinery inside of her egg doesn't work as good as it used to, and it tends to pull too many chromosomes away or leave too many chromosomes behind. And a classic example is something like Down syndrome. With Down syndrome, all the chromosomes get pulled away that should, but chromosome pair 21 stay together. And when the egg gets released, the egg now has 24 chromosomes, not 23. When the sperm come in, the embryo has 47, not 46. That one extra chromosome causes all the things that are associated with Downs. And so that can happen with every chromosome. Now, most embryos with too many or too few chromosomes, aneuploid embryos, either won't implant, or if they do, they're going to miscarry early. But again, some of them will get carried on to term. And so to try to avoid that problem, we can sample embryos and look for the absolute number of chromosomes within an embryo. Again, we use IVF technology, create embryos in the lab. We then test those embryos and take a look to see if they have too many or too few chromosomes.